Metrics such as clicking the right box on the electronic health record, washing your hands twice during an office visit, or even a 30-day readmission rate, those are the extrinsic definitions of value in healthcare today, as defined by the insurers and the government. And some sound better than others, but the question is that whether or not they generate any true value. Are both individuals in the exchange of money for services better off because those things occurred, or is their status unchanged? That's the question. Because all healthcare is an exchange of services for consideration. It's kind of odd in that the patient is only paying a portion of the cost and a nebulous third-party person is paying the rest, but it is the patient who not only decides when to initiate the transaction, but also suffers the consequences when the transaction isn't realized to his satisfaction. Curiously, even though that's the case, the system puts more emphasis on what the healthcare payer feels is value, whether as opposed to the individual that's actually seeking the service. And that is the fundamental error in healthcare delivery today. If you recognize that healthcare is an exchange of services for consideration between the patient and their clinician, then you can start unpacking where true value is generated. And let's face it, when you ask people what they want their own personal clinician that's known them for a long time, that they can trust to tailor their care to their specific desires. As a clinician, you could get penalized if you don't order screening colonoscopies or screening colon cancer tests on individual patients. You get penalized for that. I see patients where ordering those screening tests is counterintuitive, is bad news for them. They've had a lot of chronic illnesses. They don't need another colonoscopy. They don't need another procedure over the next year. Not only would there be no net positive value, there'd be negative value to the patient. In that situation, generating value is the doctor talking to the patient saying, hey, you need to be screened for colon cancer, but we can wait. I think the value of the risk outweighs the benefit in you. And that's great. That generates value. And it also saves money because no one's paying for a colonoscopy. But that same clinician under a metric-based system is going to get dinged and is going to lose revenue if he does that to too many patients. And that's an example of the perverse incentive when the organization that is paying but not generating the actual visit is the one calling the shots as opposed to the actual purchaser of healthcare. So if you want to just have the most simple, basic lesson looking at developing and designing value-based care systems is you got to think as a patient, and we've all been one, think as a patient, what's going to generate value for me during this encounter? Then you build your healthcare delivery system around that, and boy, it starts self-reinforcing, and pretty soon, you've got a pretty good system on your hand.